Silva, your hand is up. You have an issue? Silva? Albert Silva? Okay. So if a member continuously refuses to keep the microphone muted, I won't have any other option but to unfortunately remove that member from the lecture session, and I'll be recorded as unattended. And you all know attendance is very key. Attendance is very important. Okay. So this is a combined lecture session of cells and tissues, and it combines all BMI, BDU, BPT, and DMR students. Excluding the weekend students, because for them they study on the weekend. But the rest of the students, as long as you are in year one, semester one, you have to attend this course unit of cells and tissues. Okay. All right, so cells and tissues is a very basic course unit, and because of that, it will be covered in a very short period of time so that I can give you enough time to proceed with other course units. You are aware that in semester one, you have a number of course units. You have the foundation course units, you have cells and tissues, you have cardiorespiratory course units, you have digestive course unit. So this is a basic course unit which is going to be covered in just a few lectures. And afterwards, you'll have to concentrate more on the anatomy course units. Remember, this semester is short, so you have to have enough time for anatomy so that you can appreciate all the required fundamentals that are going to be relevant in your respective disciplines. Okay, once again, I kindly request Caleb and Lynette mute their microphones. I don't know why it's still a challenge for people to control their gadgets. Kindly try to control your gadgets. This is an online session. If there is any interference from just one participant, it can spoil the entire session. So let's try to have control of our gadgets, please, and our backgrounds. Okay, I think we can start. So In this course unit, we are going to cover these respective topics. They are not many. They are simple fundamental topics. Just 8. Number 1, so they are simple fundamental course units. Number 1, we are going to have an introduction to human anatomy. Okay. Before we start the details of cells and tissues, we are going to have a brief introduction of human anatomy, how the human body is organized, and then cell structure and function. What is a cell? What are some of the components that make up your body's cells, and how are they relevant towards the normal functioning of cells and the entire body? We are going to look at the concept of cell cycle and cell division. Then epithelial tissues, connective tissues, muscle tissues, and nervous tissues. These are the chapters that are going to be taught under this course unit. Simon Patrick, your hand is up. Let me hear from you. Simon Patrick.
Excuse me, I don't know if I'm the only one. You sound a little bit low. Kindly, I request if I'm not the only one, then maybe try to.
Okay. Is my voice low to everyone? Is it low? Is it very low?
No, we are hearing
well. No, we are hearing well.
It is moderate.
Okay. Emily Atuhaire, let me hear from you. Your hand is up. Emily, I beg your pardon.
I'm not accessing what is written on the screen. I don't know why.
Okay, so that sometimes happens if at all your network is weak. So what you're going to do, just refresh that page. You'll be able to get back to the session, and I believe you will be in position to see what is on the screen. Refresh. Within a minute, it will be back. You try that. Silas. What's the issue, Silas?
Okay, I wanted only to make her know that I had that same challenge, and she should go up to the left. That thing that looks like a contact. Let her tap there.
Okay, so there is an icon of refreshing. I believe she will be able to see it. Refresh and everything will be okay. Then lastly, let's hear from Rose, then we start. Rose, you have the same issue or you have some other issue? Rose?
Good morning, sir. I would like to know whether this lecture is being recorded.
Rose, if you look at your screen, I believe you can see a red icon showing minutes and seconds moving. And when you see that, it's an indication that the lecture is being recorded. Are you seeing that, Rose?
Yes, sir,
Okay.
I've seen. Thank you so much.
All right, so let's proceed. So I was saying, this is our coverage, and I'm going to be covering up to number 6. Always I provide objectives for chapter 7 and chapter 9 for students to engage actively in their respective discussion groups so that they do what we call self-directed learning. Always it's important that you impart the idea of research, you seek for knowledge, and that is very important right from semester 1, because at the end of your program, there is a course unit of research. You're supposed to find and solve a problem during your research work. So these chapters will provide you with objectives and resource or a reference textbook that you can use to read and discuss. Okay, then these, I'm going to cover them through the lectures. And these lectures are going to be online lectures. Since we are a big number, I find it comfortable that we can easily cover these online. In this session, we are going to do 1, 2, and 3 in this session, if time allows. All right. So we are going to start with the basic introduction to the human body. And of course, this is what we are going to be covering under that chapter. Number 1, the basic definitions and terminologies. We are going to describe the meaning of the term anatomical position and other clinical position, plus their indications. We are going to look at what we call the body regions, the directional terminologies, and what we call the anatomical planes. So these subtopics, they are intended to give you a basic understanding of the human body. If you understand this, everything will be smooth throughout your journey in anatomy. So we are going to start off with some basic definitions. What is anatomy? I believe you all know. What is anatomy? I said in the beginning, if you have an answer to a question, you raise your hand, then I choose you so that you can speak. That will help us to maintain some order throughout the session. So anyone who can tell us the meaning of the term anatomy? Lugada. What does the term anatomy mean?
Good morning, everyone. Anatomy is the makeup of the body.
Anatomy is? I beg your pardon?
Anatomy is the structural makeup of the body.
Structural makeup of the body. Okay, so simply, anatomy is a branch of medical science that deals with the study of human body structures and their relationships. Within the human body, there are very many structures in there. The lungs, the blood vessels, the heart, the kidneys, intestines, very many. So in anatomy, what we do, we look at these structures. For example, if you talk about the liver, we examine the details of a particular structure. We find out what a particular structure of the body is made up of. That is very important, because if you understand what body structures are composed of, you can easily appreciate their function. And that is what physiology is. The study of, it's a branch of medical science that deals with the study of how human body structures function to sustain life. The liver is very important in human. It has very many functions. If you appreciate its structure, you can easily understand its roles in the body. Disease related to that part of the body, for example, the liver. And this brings us to a term that we call pathology, and pathology simply means the study of diseases. Okay? You're going to always be looking at different disease scenarios. For you to appreciate a particular disease scenario, let's say of the liver, you have to first understand the liver by structure. You understand the normal anatomical structure of the liver. If you know it, you can easily appreciate the structural problems within the liver, either on ultrasound, either on X-ray, either on CT, or on MRI. Okay? Leave alone that, if you understand how the liver functions, you can easily interpret the clinical signs and symptoms. Let's say the patient is coming to you with a medical report with specific signs and symptoms, or the patient may be just coming to you without even a medical report with signs and symptoms. As a medical personnel, you have to understand, you have to be understanding what those clinical signs and symptoms mean. If you understand what they mean, you can easily conclude and tell the particular condition that may be affecting this patient. You can have a guess of a particular condition, a guess that can be confirmed through physical examination, through imaging, or any other type of diagnosis. That's why these terms are very important. If you know the anatomy, the physiology, you can understand diseases, and that can help you as an imaging person or as a physiotherapist. If you understand your musculoskeletal anatomy very well as a physiotherapist, you can't fail to help any kind of patient with a musculoskeletal disorder, okay, or any other disorder related to any other body system. Could be a patient suffering from a stroke. You can easily help such a patient if you know the basis of that particular condition. Okay. There are some other related terms, for example, embryology. Embryology deals with the study of how body organs form, or how the human body forms in general. We know that it takes about 38 or 40 weeks for the baby to fully develop. And right from early weeks, many changes keep on happening so that body structures form normally. And this is very important, mostly to the imaging students, because you're always going to be receiving mothers so that you can scan and tell if the embryo or the fetus is normal or abnormal. You can easily conclude that if you know how body structures form. If you don't know how the heart forms, if you don't know the common abnormalities of the heart, it may be hard for you to identify them on ultrasound or on any other imaging modality. So that's why this is also very important. And when you start your gross anatomy, let's say the cardiorespiratory anatomy, and let's say you're being taught the heart, even though the development of the heart is not taught to you, you have to seek that knowledge and learn about it. Because if you know how the heart, the lungs, the diaphragm, if you know how those cardiorespiratory structures form, you can easily understand the abnormalities or the anomalies related to those particular structures. The reference textbook for embryology is called Langman Medical Embryology. It's a textbook that I think some of you may be having, or your colleagues in semester 2 may be having it. So when you reach the gross anatomy, have that textbook on the side to help you appreciate the embryology. Radiographic anatomy, the study of internal organs of the body with the help of imaging modalities, could be CT, it could be X-ray, MRI. All those modalities can be used to study the internal organs. Okay, so that's the radiographic anatomy. And to appreciate these images very well, you have to be knowing the gross anatomy of the particular parts of the body. Okay, by the time you reach third year, or by the time you finish second year, you'll be able to interpret these images very well. But of course, early in your studies, right from semester 1, we are going to be using these pictures so that you can easily relate your anatomy to the imaging. Okay, because we always use these images to examine students, either in the final exams or during the vivas. So as you learn the anatomy, we shall also chip in a few images to relate the anatomy with what you see in the pictures, radiographic pictures. Then we have sonographic anatomy. In sonographic anatomy, basically you study the internal organs of the body with the help of ultrasound. Okay. Basically, sono means sound, and ultrasound uses basically physics principles. You're going to study physics. It's going to help you out in appreciating how these modalities work. But basically in sonographic anatomy, ultrasound waves go through the body and help you analyze a particular organ. For example, here, these waves are going through the body to reach this female pelvic cavity so that we can understand and visualize the uterus, the urinary bladder with ease. So that is sonographic anatomy. Again, as you reach these systems of the body, these images are going to continuously be used so that you can have a clear understanding of sonographic anatomy. So that by the time you reach clinical years, everything will be smooth on your side. Okay. So there is something that we call the anatomical position. And the anatomical position, you can describe it as that standard body position that is used when describing the body structures. Ideally, if you're examining or describing body structures, you have to imagine this kind of anatomical position. You have to imagine this kind of body position. In anatomical position, you imagine a subject standing erect meaning upright, facing forwards, with the feet pointing forwards, the palm pointing forwards, and the arms on the side of the body. In this kind of standard body position, we obviously take that all these structures that you're seeing, they are oriented on the front side of the body, which is obvious, or on the anterior side of the body. And then all those structures that you can't see, they're oriented towards the back side or the posterior side of the body. Having this in mind can help you prevent confusions, even though the patient is positioned in any kind of clinical position. You still have in mind that this is the anterior aspect of the body, and the other side, opposite side, is the posterior aspect of the body. This is the superior end of the body, the part of the body that is oriented upwards, and then this is the inferior side of the body. Just like the map, we know that the map has got the north, the south, east, and west. Even though you tilt this map, the north will remain the north, the east remains the east, even though you tilt it. Same goes to the human body. Regardless of how the patient is positioned, this is the anterior aspect of the body, or this, where I'm positioning my cursor, or this is the anterior aspect of the body, or the front side of the body. Then in this position here, this is the posterior aspect of the body, okay? And that side where the patient is lying, that is the anterior aspect of the body. So as you're handling patients, you have to describe organs of a particular patient as if that patient is standing or oriented in the anatomical position. Even though the patient is positioned in any clinical position, you have to have in mind of the anatomical position so that you don't make confusions as you describe the internal organs of the body. So this clinical position is called the spine position. It's called the spine position. That's a position attained when the patient is lying on his or her back, facing upwards. That's a spine position. It's a position that is used in most cases when examining the, let's say, the chest, the abdomen. This can be a good position to examine the chest and abdomen. Then we have the prone position. This is a prone position, and it's a position attained when the patient is lying on his or her belly, facing downwards. Okay, that's the prone position. And then here we have the so-called Fowler's position. Now, to attain this position, the patient's bed can be tilted or elevated at an angle, okay, so that we can attain what we call the Fowler's position, or what you can also call the semi-sitting position. This is a good clinical position that can be relevant. Let's say when there is need to feed the patient using the feeding tubes. In such a position, there can be less risks of aspiration. So it's a good position to feed the patient. It's a good position it's a good position for patients that may be having, let's say, respiratory problems, patients who can't breathe well. This is a good position to allow easy air circulation. That's a Fowler's position. But remember, regardless of any clinical position, this remains the anterior aspect of the body. Okay. And then this remains the posterior aspect of the body. This is the superior end of the body, the inferior end of the body. As you're describing any body organs here, you have to put that in mind. You have to know the direction. Okay. You have to know the you have to know the standard anatomical position in mind. If someone is raising their hand, I'm going to choose you. Just a minute. There is this other position. It's another clinical position. You can see the patient is lying on the right side. Okay. We call this the right lateral recumbent position. Right lateral recumbent position. The patient is lying on the side, on the right side. If the patient is lying on his or her left side, we call that the left lateral recumbent position. Okay. So this is another good clinical position that can be used even during scanning. Let's say you want to scan the antrum of the stomach. This can be a good position. If you want to appreciate the kidneys well, the right kidney well, you can position your patient in this right lateral recumbent position if you want to appreciate the left kidney very well. So it's a good position. Sometimes it can be called the recovery position, a position that can be used. Let's say if the victim was fainted, for example, or a victim who is having breathing problems, this victim can be positioned in this kind of side position or recumbent position. Why? Because in such a position, there'll be low risks of the contents in the mouth from entering into the airway. Okay, so aspiration is minimized in such kind of position. But if you leave the victim in such a position, it's possible for choking to easily happen in this patient or victim. That's why this recumbent position can be used. In nursing terms, it can be called the recovery position also. Okay. But regardless of any way how the patient is positioned, this remains the superior end. This is the anterior aspect of the patient. That's the other side that you can't see, the posterior aspect of the patient. Then this is the inferior aspect of the patient. So that's why it's important to appreciate the anatomical position. It's a standard body position. It's a standard map of the body. Regardless of how the patient is positioned, you have to be having this map in mind. This is the front side of the body, which is obvious.
Okay. Miss Harrison, I was asking on Fowler's position. I've seen that patient is kinda seated. Can I call it a semi-sitting position or semi-recumbent? Or it doesn't apply there, it is Fowler's position itself.
Ashaba, Mr. Yason is off. You're talking to yourself or to the students.
Okay. So I'm back.
Ashaba, Mr. Yason stated that it can also be called semi-seated. So you are right.
Hey, okay.
You only missed it. You only just missed it. Yeah.
Okay.
Thank you, dear.
So sorry for that. It was just a call that had put me off, but I'm back. There are individuals who had raised their hands. I can take their questions now, then after we continue. Okay, Patrick. Let me start with Patrick. Okay, Patrick is not speaking. Samuel, Mumbere Samuel.
Good morning, sir.
Good morning.
My question was about the reference textbooks of embryology. I'm sorry to take you back. So there is a textbook you told us about, so I didn't hear the name well.
So whenever you are to read about the embryology of any body organ, as long as you want to appreciate how any body organ forms, you use a textbook called Langman. Let me type it here. It's called Langman. You can even try to download it. You can visit, there's a website that allows you to download any book, any textbook that you want. It's called that's the website. You can find a textbook there. Langman's Medical Embryology. You can find the 14th edition on that website. If you fail to get it, you can communicate to me through your class representative. I try to send it. It's a bit heavy, but I can try. All right, so let's continue. Okay, so those are some of the clinical positions. In this slide, we have what we call the lithotomy position. This is another clinical position that is always used in case there is need for a vaginal exam, a pelvic exam to be carried out, or it can also be used during vaginal delivery, okay, or any surgical procedure of the pelvic region. That's a lithotomy position. The patient is positioned in such a way that the knees are bent at an angle, the right angle. Okay. Then there is this other, not always, not commonly used, but it can be used in some emergencies. It's called the Trendelenburg's position. Now, in this position, the patient is positioned in such a way that the feet are above the level of the head. Okay. And this can be a good position, let's say in a patient who may be a victim of severe hemorrhage. It can be a good position in such a victim because you realize that whenever there is severe hemorrhage, there is always a lot of blood that is lost. So this can be a good position to allow easy circulation of the remaining blood in the body towards the brain easily. Okay, blood can easily circulate towards the brain, and that can prevent brain injuries. Because if the brain spends about 4 or 5 minutes without receiving sufficient blood, it can easily undergo brain death. And that is hard to reverse. So this is a good position to allow easy perfusion of blood to the brain in a patient with who has been suffering from severe hemorrhage or circulatory shock. It can also be a good position to easily access the lower parts of the body during different surgical procedures. Okay, so these few slides, we are just trying to explain the concept of anatomical position, okay, and also other clinical positions that can be used in a clinical setting. And I said all those other clinical positions, if at all a patient is in any of those other clinical positions, you still describe the body as if it is in this standard anatomical position. You have to remember that. Okay. Going forward, body regions. The human body is complex, you all know that, but we try to make it simple and easy to understand by breaking it down into various regions. Broadly, there are 2 regions of the human body. Number 1, the appendicular region, and this appendicular region, it's a region made up of appendages. Appendages are extremities. We have the upper extremity and the lower extremity. You can also call these the upper limb and the lower limb. Each of these limbs have segments. The upper limb has got a segment between the shoulder and the elbow, that is the arm. Between the elbow and the wrist, that's the forearm. This lowermost segment is the hand. Okay. Ideally, if I tell you to raise your hand, and let's say we are in a physical lecture and you raise this entire limb, it will not be anatomically correct. Okay. Anatomically, this is the hand. This lower limb is also divided into 3 segments. The segment between the hip and the knee is the thigh. The segment between the knee and the ankle is the leg. And then the lower segment is the foot. So these regions, these different regions make up overall the appendicular region. Of course, we know that the upper limb is made up of very many muscles, very many nerves, very many blood vessels, which you'll appreciate when you cross to semester 2 as you study the musculoskeletal system. Very, very, very important, not only to imaging students, but also to physiotherapy students. Okay. Another broad categorization of the human body, we also have the axial region. This is the axial region. This was the appendicular region. This is the axial region. It is called so because it is nearly in the central axis of the body. And it's comprised of the head. Below it, we have the neck. Between the level of the shoulders and the lower limbs, we have this whole section that we call the trunk. A trunk that is made up of the chest, also what we call the thorax. Below that, we have the abdomen. These two are separated by the diaphragm. You can't see it here, but it's there, separating the thorax from the abdomen. We know that within the thorax we have the lungs and the heart and other very important vessels and nerves, lymphatics, very important structures there. In the abdomen, there's a lot. There's a lot. Organs of the digestive system, organs of the urinary system, organs of the endocrine system like the adrenal glands. There are many categories of organs inside there. Below the abdomen, we have what we call the pelvic region, or what you can simply call the pelvis. Now the pelvis, it's a very small area of the body, but it contains many vital structures. Organs of the digestive system, like the rectum and the anal canal, organs of the urinary system, like the urinary bladder in both men and women, organs of the reproductive system, in men, the prostate and others, in women, the uterus, ovaries, fallopian tubes and others. So it's a very important part of the body. Below the pelvic region, we have the perineum. The perineum is that area of the body between the anus and the external genitals. In men, that area is between the anus and the scrotum. In women, between the anus and the vagina opening. That area, that small area, is called the perineum. It's very important. It has very many vital structures that are very critical. You learn about all these as you continue. This semester, you're only going to cover organs in the chest and organs in the abdomen this semester. The head has got, of course, many sensory organs of the body, but also a vital organ inside that we call the brain. Below the head, we have this constricted area is the neck. It contains a lot of structures. There are many, and I can call upon a few members to tell us the contents there. Let me hear from Dan, Aliganyira Dan. Are you with us? Aliganyira Dan, are you with us? Tell us any structure that you think is found in the neck. Dan? So always in an online lecture, if someone doesn't unmute, if called upon, it simply means that that person is not attending the lecture, and that person can be recorded as unattended, and that's not good, because attendance is very critical. Okay, there are some marks that we give for attendance, and every mark is very important. You can be having 49, just yearning for just one mark to cross the border. Okay, so every mark is very important here. So Dan, are you with us or not?
I'm here, sir.
Okay. Tell us any body structure that is found in the neck region.
The esophagus.
Okay, in the neck we have the esophagus. It's a very important structure that allows passage of food to the stomach. Okay. Let me call upon random. Let me call upon Justa. Justa, are you there? I don't know if I have pronounced the name correctly, but Justa, are you with us? Okay, he has not attended.
Yes, I'm on. I'm on, sir.
Okay, just tell us any body structure that is found in the neck region.
The thyroid gland.
Thyroid gland. Okay, and very many others. We have vital blood vessels there, and many others as you learn, as you continue with your anatomy. So these are the regions of the body, as simple as that. Okay. Now this slide tries to broadly show all the regions of the body. We've seen that we have the head region. The head region can also be called the cephalic region. Now, in the anatomy textbooks, as you read the anatomy content, you find English terms and other terms that may be confusing. Okay. Now, for example, this is the head region, but it can also be called the cephalic region. Cephalic, it's just a Latin word that means head. So you should always take note of those terms. They can be used in questions. They can be used in a clinical setting. You should always appreciate them. And the only way to know all this is if you read textbooks. You shouldn't always rely on the lecture notes. Lecture notes are very summarized. You can't rely on them. They just guide you on what you need to know. But textbooks shows you all the detail, provide all the details, and we use textbooks to examine, to set questions. So you have to always read textbooks. The neck can also be called the cervical region. Cervical means neck. Okay. We say this whole region is the trunk. Okay. And we say it's divided into the chest, abdomen, and the pelvis. Okay. Then this is the lower limb, and then this is the upper limb, and the respective segments or subdivisions. So I'm not going to further break down each. You further learn this when you start musculoskeletal. I've given you an overview. But also you have to note these Latin terms that are used in conjunction with the English terms. Now, femoral means, the femoral region means the thigh region. Why? Because in here, we have some special blood vessels that we call femoral blood vessels. Femoral artery, femoral nerve, femoral vein, those neurovascular structures, they have the term femoral. That's why we call this the femoral region. The word femoral means thigh. Okay, so there are many terms that are used in conjunction with the English words, so you should always take note of that. Directional terms. Directional terms are terms that are used to describe the locations of different body structures. And these terms, you'll always be using them as you write down your reports. Okay? Once you use them clearly well, your reports will be easily understandable to anyone, even if that person never interacted with your patient to scan and see whatever problem may be there. So directional terms helps you to describe the location of body structures, the relationship between structure A and structure B, and that is very, very important, not only for writing down medical reports, but also as you communicate with your let's say your supervisor or your colleagues. You're going to be communicating using directional terms. So this is another language that you're always going to be using, a language used to describe the human body accurately to prevent any confusions. Okay. These directional terms can be used to describe the physical presentation of the patient, can be used to describe the position of body structures. For example, here this patient is having a fracture in this bone of the arm. So there is a term that you can use to clearly tell the location of this structure, in that even though you're talking to someone on the, let's say you're calling this person, even though this person has not seen the image, this person will easily know where that fracture line is. Okay, so you have to appreciate these terminologies because you're going to be using them forever. So these terms are arranged in pairs. You can see here we have anterior, posterior, craniocaudal, superior, inferior. We have proximal, distal, medial, lateral. They're in pairs, and we are going to look at each pair independently. We shall start with medial and lateral. Medial and lateral, these are terms used to describe body structures in relation to the midline. They describe how close body structures are in relation to the midline. For example, let us look at this picture here. This is a picture of the inside of the abdomen. Of course, some structures have been removed, the intestines have been removed, but you can see a few structures in here. We have the kidneys here. This is the inferior vena cava. This is the aorta. These are the adrenal glands here. We have some muscles here on the side and other structures. So if you look at this image here, I can comfortably say that the IVC is medial. The aorta is medial. Why? Because these two structures are close to the midline. Medial is used when a particular structure is close to the midline of the body. So these two vessels are medial. If you look at this picture, in this picture, I can comfortably say that these muscles of the lateral abdominal wall, these muscles are lateral. They are oriented towards the sides of the body, and that's what lateral means. If a particular part of the body is directed or positioned towards the side of the body or away from the midline, we use the word lateral. Okay. Secondly, you can use these words, these terms, to describe the relationship between any two structures here. For example, let me use an example of the right kidney, this one here, and the inferior vena cava here. Now, if you look at the right kidney and the IVC, which of the two is close to the midline? Obviously, the IVC. So I can construct a sentence and say that the IVC is medial to the right kidney. That statement means that the IVC is closer to the midline as opposed to the right kidney. Another person would wish to use the word lateral. That person will say the right kidney is lateral to the IVC. That means that the right kidney is more closer to the sides than the IVC. So I'm using these terms to describe the position of body structures in relation to the midline, but also to describe how these structures are related to each other. Okay. More examples can be used. Let me call upon, or anyone can raise their hand and tell us one more example. I want someone to relate the position or to describe the relationship between any two body structures here using the word medial. There are many structures here. Just choose a pair of structures and describe their relationship using the word medial. Let me let me choose Elizabeth. Tomusime Elizabeth.
Good morning, everyone. The aortic arch is medial to the left lung.
Thank you very much. So the aortic arch, for those that may not be knowing, we always have the aorta coming out of the heart, and it makes an arc to the left. Okay, so this raised or this curving portion of the aorta, we call it the aortic what? The aortic arch. So he has said that the aortic arch is medial to the left lung. That is true. This is the left lung. This is the aortic arch. Okay, so the aortic arch is almost in the midline. Or we can say easily it's approximated to be almost in the midline. So you can say it's medial to the left lung. That's a good example. Let's get two more examples. Angela? Angela?
The heart is medial to the left lung.
I beg your pardon?
The heart is medial to the left lung.
The heart is medial to the left lung. That's true. But also someone can say it's medial to the right lung. Okay, because these lungs they are more lateral, they are more to the sides, and this is, we can say, almost in the midline, or we can say it's medial, okay, to these lungs. Okay, that's another good example. Let's get just one more example from Kosi, Atuhaire Kosi. Yes, Atuhaire. Okay, I don't know why she's not speaking. Amos, Lokong Amos. I don't know if it's my network, but I don't seem to hear anyone. The rest, can you hear what they are saying?
Yes, we can hear.
I didn't pick him well.
Okay. Lokong, Amos, one more time. Can you be audible so that I can see if I can hear? Oh, Lokong, you get close to your mic. Get close to your device. You seem to be away from it. Okay, let's hear from Elizabeth Ruth.
The gallbladder is medial to the right lobe of the liver.
Okay, this is the liver. We have the right lobe here. We have the left lobe here. Okay, now if you look closely, this is the right lobe. Okay, and this is the gallbladder. Now, it may not be perfect to describe the relationship between these two using the word medial, because if you look at these two, they are almost in the same plane. Okay, and it's better using another term, which may be either superior or inferior, as we are going to see later. But we can just mention that you can say the liver is superior to the gallbladder. The word superior means above. It's oriented above the gallbladder. This right lobe of the liver is superior to the gallbladder. Some other person can say the gallbladder is inferior to the right lobe of the liver. So those are perfect terms that you can use to be accurate, but not medial. Is that clear, Ruth?
Yes, sir. Clear.
All right. Okay. So many examples can be mentioned here to further describe medial and lateral, but I believe we have all understood. So we can go on. Just one more example, maybe in this image. Here we can see the stomach. Here we can see the spleen. Now, these two are in the different, are not in the same plane like these in these previous examples. So we can comfortably use the term medial or lateral. Anyone to phrase a statement to describe the relationship between the stomach and the spleen using the word medial? Let me hear from Innocent Oni.
The stomach is medial to the spleen.
So I beg your pardon, I didn't get you, Innocent. You were saying
the stomach is medial to the spleen.
The stomach is medial to the spleen. Now that statement means that when you compare the stomach and the spleen, the stomach is more close to the midline than the spleen. Another person can say the spleen is lateral to the stomach. And that statement means that the spleen is more closer to the side of the body as opposed to the stomach. So that's how you can comfortably use those terms. Another person can say this part of the large intestine here that we call the ascending colon is lateral to the coils of the small intestines. Then another person can say that the coils of the small intestines are medial to the ascending colon. So it's really easy using those terminologies. Now I'm giving you a task to find out the meaning of these terms. These terms are derived from the word lateral. There's what we call contralateral, ipsilateral, bilateral, and unilateral. When are they used? Find out their meaning and also derive examples to show how they are used. That's your personal research. Okay. Superior and inferior, I've somehow talked about this. So the word superior is just a Latin word that means above or towards the head. Inferior means below or away from the head. And these terms can be used during the description of different structures of the body. For example, if you look at, for example, let's use an example of the eyes, okay, and let's say the nipples. These are nipples. If you compare the relationship between these two, the eyes are more superior. They are already in the head region. They are towards the head. These are below, so they are inferior. If you look at the relationship between structures, this is the right kidney here, this is the adrenal gland. Someone can say that the adrenal gland is superior to the kidney in this example. That statement means that it is above, it's situated above the kidney. Then the other person can say that the kidney is inferior or below the adrenal gland. So you can use those terms like that. Then as we describe the fetal anatomy, we can also use the word superior and inferior, but it's comfortable using cranial and caudal instead. Cranial means superior, caudal means inferior. So the structures that are oriented towards the head region, we can say they are cranial in position. Okay, and then of course these lower structures close to the lower end of the body, they are caudal. Okay, so cranial means superior, caudal means inferior, as simple as that. So many examples can be used, okay, to describe further superior and inferior. Let me use more examples here. There is the right lung. This is the right dome of the diaphragm. Someone can say that the right lung is superior to the right dome of the diaphragm because it is above the dome of the diaphragm. So we just say it is superior to the right dome of the diaphragm. Okay. Someone can say that this horizontal part of the duodenum is inferior to the head of the pancreas because it is below it, as you can see. Okay. Let's get one more example from anyone. Relate two structures using the word superior or inferior. Anyone? To relate any two structures using the term superior or inferior. Yes, Alex.
Good morning to everyone. What I can say.
Yes. Alex,
Hello.
are you speaking to us?
Yes, I'm speaking. The diaphragm is superior to the two kidneys.
Okay. When you relate the position of the diaphragm, this is the diaphragm, and this is the kidney here. Now, this may be tricky. Number one, it's always easy to describe the relationship of these internal organs as long as these organs are close to each other. Okay. The whole of this is the diaphragm. So someone can better say that the diaphragm is posterior to, for example, this dome of the diaphragm, the lower part of the dome of the diaphragm is posterior to the right kidney. This is the right kidney. These muscle fibers are posterior, they are behind the right kidney. Okay. If this right kidney was situated around here, there we could comfortably say that the right dome is superior to the right kidney. We can use that relationship better when you're describing, let's say, the position between this left dome and the spleen. Someone can say the left dome of the diaphragm is oriented superior to the spleen, or the spleen is oriented inferior to the left dome of the diaphragm. Okay, there are many examples that we can give here. Very many examples. All right. Let's look at this. These terms can be used to even describe just one structure. For example, if you look at the lung, for example, it has margins. These margins are facing in different directions. Now, this upper margin that is facing towards the head can be called the superior margin or the superior border of the right lung. This one facing away from the head downwards can be called the inferior margin or the inferior border of the right lung. This margin facing the midline, it can be called the medial margin or the medial border of the right lung. And this one facing towards the sides can be called the lateral margin or the lateral border of the right lung. So these terms can be used to describe the structure of an organ. Here we have the liver. Of course, this is the superior border of the liver because it is directly towards the head. This is the inferior side or the inferior surface of the liver. This is the lateral, this is the medial. Okay, so you can use those terms in many ways. Then we have anterior and posterior. I've partly mentioned about this. Anterior means front or towards the front side of the body. Posterior means towards the back side of the body. Of course, a very basic example, eyes, nose, the mouth, these structures are oriented anteriorly because they are on the front side of the body. Okay, so many examples can be used here. This thyroid gland, you're seeing the thyroid gland, part of it is situated anterior to the trachea. This portion is in front or anterior to the trachea. Someone can say, which other example can we use? Anyone to provide an example? Anterior and posterior. Anyone to describe the relationship between any two structures of the body using anterior or posterior? Yes, Lawrence. Sarah Mirondi Nakabugo. Sarah. I don't know if she's speaking or it's my network. Christine, let's hear from Christine.
The right lobe of the liver is anterior to the spleen.
The right lobe of the liver is anterior to
the spleen.
The spleen. The right lobe of the liver is not in any way related to the spleen. These structures are distant from each other, and you can't use the word anterior.
Sorry,
okay,
to the gallbladder.
Some part of the right lobe of the liver is anterior to the gallbladder. Okay, so the position of these two structures will further be studied, but you can appreciate that someone can say that the right lobe of the liver is superior to the gallbladder. Another person can also comment and say that the right lobe of the liver, part of it is anterior. Okay, as you can see, anterior to the gallbladder. Okay. Any other example? There are many examples. Let's hear from Timothy. Timothy. In Baba Zeroth.
The liver is anterior to the lesser omentum.
The liver is anterior to the lesser omentum. So, can we see the lesser omentum here? If I may ask, Timothy.
The ascending colon is anterior to the right kidney.
Just a minute. Someone commented and said that the liver is anterior to the lesser omentum. I will not comment on that because, first of all, right now, we may not be knowing what the least momentum is, so I will not comment on that answer. Okay, let's have another example using the structures that we see so that other members are not confused. Just one more example. Yes, Angela?
The thyroid gland is anterior to the thyroid cartilage of the larynx.
The thyroid gland is anterior to the thyroid cartilage of the larynx. So now I want you to look at this. Yes, you've not studied yet, but you can just look at this. The gland, it's nearly U-shaped, as you can see. There is some part of it which lies on the sides of the thyroid cartilage. Okay. So you can't say that the thyroid gland is anterior to the thyroid cartilage of the larynx, but instead you would say, anyone to put it right? Anyone to put it right? You've just seen this. Again, I'm saying the gland has this central portion and this portion that is running towards the sides of the thyroid cartilage of the larynx. As he commented, this is the thyroid cartilage of the larynx. So initially he had said that the gland is anterior to the thyroid cartilage of the larynx, and I say that's not correct, but there's another term that can be used to relate the cartilage and this portion of the gland on the side of the cartilage. Which term is that? Let's hear from Bagonza Sharon. Let's hear from Simon Patrick. Let's hear from Sheila. I don't know, people are not speaking. Kabugo Sheila.
I could
Maybe
try
I
and
can
come in.
say,
Yes, Sheila.
I can say the thyroid gland is inferior to the thyroid cartilage of the.
No, inferior cannot apply here. Anyone to try again? Let me hear from Gerard Job. Gerard Job.
Maybe I can
Yes, please, sir.
say the
Rogers, you have to mention after being chosen to prevent confusions. We are hearing from Job.
Yes, for me, actually, I'm trying to follow the lecture. My is not showing the videos, but I wanted to give an example of posterior and posterior.
Job, we are still on this example. I don't know, anyone to make it right?
Let me try.
Okay.
Okay, Simon Peter, you can try.
Simon Patrick, not Peter.
Yes, Simon Patrick.
I would say the thyroid cartilage of the larynx is medial to the left lobe of the thyroid gland.
Yes, so these two structures, you can describe their relationship using either lateral or medial. Okay, this portion of the gland that is projecting upwards, you can say it is lateral to the thyroid cartilage. Or someone can say that the thyroid cartilage is medial to this upward projecting portion of the gland. Okay, but anterior will not fit here. Let's have
Excuse me.
more examples to describe. Yes, someone has a question.
Yes, it's not a question. I am trying to see how to maybe be repetitive. Still in regard to that same example. The thyroid gland has an anterior part. Now, that anterior part of the thyroid gland is still anterior to that cartilage. The anterior thyroid part of the thyroid gland is anteriorly located.
Okay. So I think you're confusing the cartilage that we are talking about. In this image, we are seeing this cartilage here. This is the thyroid cartilage. And then down here, where my cursor is, these are cartilaginous rings of the trachea. So which cartilage are you talking about? Do you mean these cartilaginous rings, or you mean this cartilage here?
Now, I don't know what the original person was referring to.
The original person referred to the thyroid cartilage. Are you referring to the same?
Yes.
So you can't use the term anterior here, because we said if something is anterior, that particular structure will be in front.
Yes.
And it doesn't apply here because this gland here, it's on the side of the cartilage. So we can't use the word anterior. Instead, we shall use the word lateral. Is it clear? Because lateral means towards the side. So we can say this projecting portion of the gland is lateral to the cartilage. Okay. But to make things easy, let's use more examples here, because those terms are very basic and very, very easy to understand. If you see the IVC, this is the IVC here, or the inferior vena cava. Are we all seeing it? This big blue vein. I want someone to relate the position of the IVC and the head of the pancreas. Relate the position of the IVC and the head of the pancreas. Anyone? Let me hear from Moses, Okirol Moses. We are hearing from Okirol Moses. Moses, your hand is up. He's not speaking.
Okay. Hello.
Yes, Moses, we
Hello.
can hear you.
Yes, I would say the head of the pancreas is anterior to the inferior vena cava.
That is true, because anterior means front. So the head is, if you remember our standard anatomical position, you could really appreciate that the head of the pancreas is in front of the IVC. Though in medical language, we don't use the word front, back, we use standard terms like anterior or posterior. So someone can say that the head of the pancreas is anterior to the IVC. Okay. And then the other person could rephrase and use the word posterior. And how would that statement be phrased? If you use the word posterior to relate these two structures. Anyone? Yes.
Hello.
Yes.
Hello.
Amos.
Hello.
Yes, Amos.
Hello. Okay, the IVC is posterior to the head of the pancreas.
As simple as
Hello?
that. Okay. As simple as that. Then there are more examples here. We have the duodenum, this horizontal part of the duodenum. It's anterior to these vessels, the IVC and the aorta. It's in front of them. That's another good example, okay? Another very good example here in the neck is the relationship between the trachea and the esophagus. Who can describe that relationship? Anyone? Between the trachea and the esophagus? Yes, let's hear from Biriki Mwajuma. We are hearing from Biriki Mwajuma. Mwajuma? He's not speaking. Atuhaire Emily? Emily, are you with us?
Yes, the esophagus is posterior to the trachea.
Very good. The esophagus is posterior to the trachea. The other person could interchange and say that the trachea is anterior to the esophagus. As simple as that. So that's how we use those terms. Now, there is another pair of terminologies, proximal and distal. Now, these terms are widely used to describe the different parts of the limbs. What are the limbs? We say the limbs are the extremities. We have the upper limb and the lower limb. The upper limb and the lower limb. The word proximal is used to mean towards the trunk or towards the point of attachment or towards the point of origin. If you look at this upper limb, for example, this is its point of origin. Look at the lower limb, this is its point of origin. Okay, so if we are to describe the segments of the upper limb, we know that this is the arm, of course. This is the what? What is this? Anyone to remind us? Anyone to speak?
Forearm.
Forearm.
The forearm.
This is the forearm. Okay. And of course, this is the hand. So we want to describe the relationship between the arm and the forearm. We can do that using the word proximal, by saying that the arm is proximal to the forearm. That statement means that when you compare the arm and the forearm, the arm is more nearer to the point of attachment of the upper limb, or to the point of origin of the upper limb, or nearer to the trunk. Okay? The arm is proximal to the forearm. Someone may be describing the relationship between the forearm and the hand. It's okay for that person to say that the forearm is proximal to the hand, because if you compare the forearm, it's more nearer to the trunk as opposed to the hand. It's more nearer to the point of origin as opposed to the hand. So we can say that the forearm is proximal to the hand. Someone may wish to use the word distal. You just interchange and say, for example, if you're relating the arm and the forearm, you just say the forearm is distal to the arm. Because if you compare the forearm and the forearm is farther away from the trunk than the arm. And that's what the word distal means. Distant. The forearm is distant from the trunk or from the point of attachment than the arm. Similarly, someone can say that the hand is distal to the forearm, because if you compare the hand and the forearm, the hand is distant from the point of attachment than the forearm, which may be seen to be almost nearer to the point of attachment than the hand. So that's how these terms are going to be used. Those terms can be used to describe any parts of the extremities, whether the joints, as you can see in these examples, okay? But you follow the same principle. A particular part of the body is nearer to the trunk or to the point of origin, we use the word proximal. Let's take one example here. We are trying to relate the position between the shoulder and the elbow. We know this is the shoulder, this is the elbow. The shoulder obviously is close to the point of origin of the limb. So the shoulder is proximal to the elbow. The opposite is true. The elbow is distal to the shoulder because the elbow is further away from the point of origin than the shoulder. So you have to learn this language. I know you know many languages. Some people speak English, Kiswahili, and many other languages. Now, this is another new language. It's a medical language that you're going to be always using as you're writing down medical reports, as you're analyzing the clinical symptoms of the patient. These are the terms that you're going to be using. Okay? And it's very, very important. Okay. The term proximal and distal can also be used to describe other structures of the body. As long as the structure has the point of origin and then the terminal end, we can use this term proximal and distal. We can use these terms. For example, this is the esophagus. We know the esophagus begins in the neck. It terminates at the level of the stomach. So we can comfortably say this is the upper end of the esophagus, or the beginning part of the esophagus. It's the point of origin of the esophagus. So we can say this is the proximal end. And then this terminal end, or the lower end, where the esophagus terminates, we can call it the distal end of the esophagus. Just like as we said on the limbs, this is proximal, this is distal. Okay, so the same thing applies here. Okay, we can use the same terms as we're describing bones. This is the humerus, it's a bone of the arm. Okay, this round portion lies the shoulder area, so it is proximal because it is nearer to the trunk. This is distal because it is further away to the trunk, from the trunk, because it's going to be making up the elbow joint. So it's of course further away from the trunk than this. The intestines, they are tube-like structures. They have the beginning end and the terminating end. So the beginning end is the proximal end. As you follow it, the lower end can also be called the distal end. So these terms can be used to describe pathologies. Patient is coming to you with, let's say, an ulceration in the lower end of the esophagus. You can comfortably say this patient has an ulcer in the distal esophagus. In the distal esophagus. Anyone in the health field, the medical field will understand. Anyone will understand, even though they have not seen any picture of the esophagus of this patient. Okay. Superficial and deep. These are also straightforward. Superficial means close to the surface of the body. Deep means away from the surface of the body. Okay. Let's use a very simple example. If you look at your hand right now, you can see some blood vessels beneath your skin. Those are superficial blood vessels because they are close to the surface of the body. But there are also other blood vessels that are away from the surface of the body. Those are deep vessels. There we use the word deep. Those are deep vessels. Okay? So you can use many examples to describe superficial and deep. Okay, so that's enough of the directional terms. Let's now look at the body planes. Let us look at the body planes. Body planes are very important. Body planes are basically imaginary lines used to describe the internal structures of the body. the patient is coming to you for a scan, you're not going to cut this patient using a surgical blade, no. You're going to analyze the internal structures of the body of this patient using radiographic tools, imaging tools, sonographic tools in different planes so that you can analyze the inside of the body clearly. So that's the relevance of planes. They are imaginary lines that help in describing the internal structures of the body. And they are broadly categorized into three. There may be many more, but there are three standard ones that are mostly used in imaging. Number one, we have the sagittal plane. The sagittal plane, as you can also see it here in blue, this is an imaginary line that divides the human body, all an organ, into the right and the left portions. You can see it here. It's going to divide the human body into this right half and the other left half on the opposite side. You can also see it here. It's going to divide the human body into the right half and the left what? The left half. This sagittal plane, just a minute, let me attend to this call, just 1 minute, and then we get back.
Ochom. Ochom.
You are distracting us. So guys,
Okay, we are
making
back. So the planes. I was talking about the sagittal plane. Now this sagittal plane, it can also be called the median plane, as long as the sagittal plane is cutting through the center of the body or the center of an organ. It can also be called the median plane. If this sagittal plane, it's let's say passing here, let's use this example. If it's passing here, parallel to the midline, we can better call it the parasagittal plane because it is parallel to the sagittal plane or to the median plane. Okay, so the sagittal plane, remember, it divides the human body or an organ into the equal right and left halves or portions, and it's also called the median plane. Okay, and it's vertically oriented, as you can see. But if there is another vertical plane parallel to the median plane or to the sagittal plane, we can better call it the parasagittal because it is parallel to the sagittal plane. Hope that is clear. And this will not divide the human body into equal right and left halves. It's this one that will divide the body into equal right and left halves. But this divides the body or an organ into unequal right and left portions or halves. Okay. Then we have, before I go to this other one, if you look closely, this is the sagittal plane, as I said in blue. It can be used to divide the human body so that we get what we call the sagittal section. This is the sagittal section of the body. we are just visualizing one half of the body. The other half, we can't see it. It has been probably dissected away. It has been cut away. We are seeing just one half of the body. And this half is called a sagittal section, attained using the sagittal plane. Then we have this one. It's called the frontal plane or the coronal plane. Now this one, it's going to be a plane that divides the human body, all an organ. I'm using all an organ because these planes can be used to study organs. For example, you may decide to scan the kidney in sagittal or in coronal plane or transverse plane. That's why I'm defining them, clearly stating that they are planes that divide the human body or an organ, so that you can prevent confusion there. So it's going to divide the human body or an organ into the anterior portion and the posterior portion. And it's going to also be called a coronal plane. So front and coronal, they are the same. They are the same. And as you can see in our picture here, you can see this purple plane here. This is the coronal plane. It's used to divide the human body in this picture into the anterior and the posterior portions, so that we can get a coronal section of the body. As you can see in this section, the anterior portions are not seen. You can't see the nose here, you can't see the mouth, the eyes, you can't see the anterior abdominal wall, okay? The anterior portions have been splitted away with the help of this coronal plane or frontal plane, so that we can attain a coronal section. Then, lastly, we have the transverse plane. This transverse plane, it's a plane that divides the human body or an organ into the superior portion and the inferior portion. And it can also be called a horizontal plane. Okay, as you can see, it runs horizontally. Okay, it can also be called a horizontal plane. And it can also be called a cross-sectional plane, because it's cutting across the body, as you can see. So you can call it the transverse plane, though here the term is misspelled. It's transverse. This should be V. Okay, it's a transverse plane, horizontal plane, or you can call it the cross-sectional plane. In imaging, we can also call it the axial plane. The axial plane. Okay. Now, this plane, it's used to attain transverse sections of the body. Or you can call this a horizontal section, or a cross section, or an axial section of the body. And thankfully, we have imaging modalities that are designed to slice the internal structures of the body with the help of these anatomical planes. Okay? The CT, the MRI can provide pictures of any part of the body with the help of the sagittal plane, coronal plane, or axial plane. For example, here you can see the brain, and you can appreciate that this brain, this image of the brain was attained with the help of which plane? Let's have hands up. This image of the brain was attained with the help of which plane? Let's hear hear from Senyondo Emmanuel. Senyondo Emmanuel. Which plane?
It is a coronal plane.
Senyondo. Image A. This is image A that we are talking about. It was attained using which plane? Let me hear from Deborah. Please, Agina, don't unmute before being chosen. I want people to unmute after me calling upon them so that we don't cause interferences. Deborah.
Yeah, thank you, sir. I think image A was done using the sagittal plane.
Thank you. Image A was attained with the help of the sagittal plane. Remember, the sagittal plane, as you see it here, this sagittal plane, it's going to cut through the head so that it can divide the head or the brain into the right and the left half. Here you're seeing one half, probably it's the right half of the brain. You can't see the other half. The other left half, you can't see it. You're only seeing one half of the brain, okay? And this is the sagittal section of the brain, okay? These imaging modalities, as I said, they can divide the body into different sections using different planes. And obviously you can appreciate that this image of the brain here, or of the head, was attained using a sagittal plane, okay? The head was sliced with the help of the sagittal plane to attain the sagittal section of the head and the brain. Then we have image B. Image B was attained using which anatomical plane? Let's hear from Daniela.
It was the
Daniela?
It was the transverse plane.
The transverse plane. Very good. As you can see, this is our transverse plane. How did we define the transverse plane? It's a plane that divides an organ into, as you can see here, it's going to divide this brain into the superior portion and this lower inferior portion. This one here, okay? And if you cut the brain using this plane, you'll obtain such a section. This is the front side of the front side of the brain, and this is the posterior side of the brain, and we have attained a section that we call a transverse section, or an axial section, or a horizontal section, because it was attained using that horizontal plane. So you can comfortably say that this image was attained using the transverse plane. And obviously this last one was attained using the coronal plane. Okay, you can't see the anterior aspect of the head in this image. You can't see the eyes, you can't see the nose, you can't see the oral structures fully. Most of the structures are they were removed because this plane sliced the head into the anterior portion and the posterior portion. So most of the structures are in the anterior portion, which we can't see. Here we are not seeing the posterior portion of the head because it was sliced with the help of the coronal plane. Because we know the coronal or the frontal plane, what it does, as you can see, it's going to divide an organ into the anterior portion and the posterior portion. You can see the head divided into the anterior portion and the posterior portion, and can help you attain coronal sections to study any structure of your choice. Okay, In this image here, the anterior aspect of the brain is not seen. Okay, we are seeing a section attained using this coronal plane, and this is the coronal image, or a frontal image of the brain or of the head as the whole. Okay, so that's how planes can be relevant in imaging. Okay, I can use very many examples to describe those planes. Okay, but if you have understood, let me just go through this very fast. So X-ray images can be obtained in different planes. CT images of any body region or the abdomen, as you can see here, they can be obtained using different planes. Okay, for example, if the CT slices your body with the help of the sagittal plane, we shall observe just 1/2 of the body, as you can see, and this is the sagittal section. The other half you can't see it. Okay, this is the anterior aspect, this is the posterior aspect of the body. So this is the sagittal section. Okay, then the transverse plane, as we've said, it's going to divide the human body into the superior portions and the inferior portions, and it's going to help us attain a cross section or a horizontal section or an axial section of the body. Okay, to study any particular structures. It can be a slice made at any part of the body. Okay, just know that any round section that you see, that's a cross section attained using an axial, transverse, or horizontal plane. And obviously this is the coronal plane, dividing the body into the anterior and the posterior. These planes, you have to put them on your fingertips. Imaging students, we always use images in different planes to examine you in the vivas, in your exams. Okay, you'll find a lot of these images in your practice. So you have to know about them. Okay, so I will also describe the relevance of these planes in ultrasound. Ultrasound can help you study internal organs of the body using those 3 anatomical planes. For example, you can see here, let's say if you want to study any structures in the abdomen, you can position this probe. This is called a probe or a transducer anywhere on the abdomen. This probe has got, as you can see in this small picture in the this corner, probes have markers. A marker, this is called a probe marker or orientation marker. If you position your probe on a patient in such a way that the orientation marker is facing the patient's head, it's obvious that you're going to attain an image in a sagittal view, because obviously you've positioned the probe in a vertical orientation with this probe mark facing upwards, and ultrasound waves are going to be emitted from the probe into the patient's body, and they are going to run in this sagittal plane into the patient's body. And because of that, you will be able to attain an image that is in the sagittal orientation. As you can see in this beta slide, let's say you want to appreciate the uterus of a given patient. You can scan the uterus using any plane. Let's say you've positioned the transducer in a way that the marker is facing the patient's head and the probe oriented vertically on a given body part of the patient. It's obvious that the waves are going to be emitted through that very plane, the longitudinal plane or the sagittal plane. And these waves are going to help in dividing body organs so that you can attain sagittal views of those specific organs on the ultrasound monitor. For example, if we analyze the uterus here, it can be divided so that we can either see the right half or the left half. Okay, it can be divided with the help of the sagittal or the longitudinal plane. The sagittal is the same as the longitudinal plane. Okay, so it can help to divide, for example, here the uterus, so that we can see just one half of the uterus. Okay, and we can call this the sagittal view of the uterus. So in ultrasound, these planes are very important. You just have to mind how you position the transducer on the patient's body. If you position the transducer in the horizontal fashion, obviously you're going to attain an image that is in the transverse view, because this probe is going to emit ultrasound waves through the transverse plane, and these waves are going to enter and help to divide a particular part of the body so that you can attain a transverse image of that particular part of the body. Again, our uterus. This is the uterus. You position the probe in such a manner, these waves are going to enter and slice this uterus so that it can be divided into the superior portion. Let me first erase this for clarity. It's going to be divided into the superior portion and the inferior portion with the help of that plane, the transverse plane. And on your monitor, you'll see just a cross section of the uterus, because we know transverse planes can help us obtain cross sections. First of all, they are called cross-sectional planes. Obviously, they are going to help us analyze organs with the help of these cross sections or these cross-sectional images. The relevance of using these planes is that you can analyze an organ in different angles. If you look at this transverse image of the uterus, it was showing us even the fundus. This is the upper part of the uterus. We are able to see it. Okay, you can see the fundus here. Okay, so in short terms, these planes in ultrasound, they can be able to help you study internal organs of the body in different angles. Okay, it depends on your preference. If you want to scan in transverse, you just position your probe in that transverse plane, if you know it. If you want to scan in coronal or sagittal, you just position your probe in that particular plane. Okay, because of the time, I'm going to stop here. I plan to continue and look at how the human body is organized, but let me stop here. We are going to have another lecture tomorrow from 10 to 1. From 10 to 1, we are going to have another lecture so that we can look at Objective 2, Objective 3, and Objective 4. How is the human body organized? What is found in your body, your body cells, and what's the function of those specific components of your body cells? What is referred to the term cell cycle, what it is, and how does it happen? How do your cells divide? Okay, so Objective 2, 3, and 4, you can revise them we are going to cover them tomorrow in our lecture that will begin from 10 to 1. Okay. Tomorrow there is some bit of there is some function here at Acure, and I just pray it doesn't interfere our timing, but tentatively we shall be meeting from 10 to 1. If there is any kind of interference, I'll be letting you know. I'll be communicating through the class representative. Okay, so Tuesday, tomorrow, 10 to 1, these objectives here. Then I'll be communicating another day in a week. After this session, I'll be communicating another day where we shall have a session of the epithelial tissues, and then another day where we shall have session of connective tissues. As I told you, this course unit is short, and I always want to cover it fast so that you can concentrate on the gross anatomy. Okay, because if you get these basic principles, the gross anatomy will be very easy. And these principles are very easy to understand. If you understand them very fast, the better. Okay. So today, that's what we can discuss. We've just covered objective number 1 fully. Are there questions before we finish, before I close off, before I sign out? Yes, let's hear from, I don't know, there are hands that are raised. I don't know if these are old hands or they are new hands, but let me hear from Okello Moses. I can see he's unmuted and I think he has a question. Yes, Moses.
Basically, it's a request. I don't know, Doctor, how we're going to have access to the notes.
So the notes, I always send them to the class representative, and class representatives share the notes in your WhatsApp group. Okay. But as I said earlier, notes are the notes that we design. They are summarized, so you don't have to fully rely on the notes. They're just to guide you. But I'm going to share them to your class rep, and the class rep will be sending them to you. Yeah, that is clear. Then the recording, or is the recording after the end of the session, it automatically posts itself on the system after a few minutes. And that recording, I think it stays there for a week, and then I don't know where it goes. It disappears. The recording is just to refresh and review what has been taught, if you want to refresh. All right, so I don't think there's any other question. These were just basics, and we've tried to handle them with care. If you have a question, unmute and speak, because I don't know, there may be hands that
Hello. Thank you for the lecture. I kindly ask for a recommendation of textbooks for further reading.
All right, so cells and tissues is appreciated using there is a textbook. It's called Principles of Anatomy and Physiology by Gerald Totora. That textbook, it just has the basics of the human body, and you can appreciate the cells and tissues within that textbook. And it's the same textbook that I can recommend you to use when you start physiology of those different systems that you are yet to learn about. But I don't recommend it as a textbook for gross anatomy. For gross anatomy, there are specific textbooks. Keith Moore, Gray's Anatomy. Those are the textbooks for gross anatomy. For physiology, Totora is okay. Cells and tissues, Totora is okay. And that textbook, I'm going to share it to your class rep after this session. Is it okay? All right. So with that, allow me to close the session. Joseph, you have a burning issue?
Doctor, thanks for the good lecture. I really appreciate it. Has been really nice lecture. And the main goes to, actually main it is all about these books, because you talked about that there are possible means you can share these books to us. If really you can, please, we shall really appreciate.
Yes, as I said, so as I was saying, there's a class rep for diploma and a class rep for the bachelor's group. I'm going to separately send these textbooks to the two class representatives, and they are going to share the textbook in your WhatsApp group. Is that clear?
Yes, sir.
All right. So with that, allow me sign out. Enjoy your day.
Thank you.
Thank you.